you're very welcome to the 6th talk in the UCD COVID-19 Research Seminar Series, which is being hosted each week on Wednesday at 2 p.m. By UCD Research. And the purpose of this seminar series is to showcase ongoing COVID-related research at UCD across the 6 colleges and to really help facilitate greater interdisciplinary collaboration within UCD and also with external partners. So today we're delighted to be speaking with Dr. Deirdre O'Donnell. Deirdre is a lecturer in health systems in the UCD School of Nursing, Midwifery and Health Systems, and she has a very strong track record of collaborative research with older people and is also co-founder of the Older People's Empowerment Network, OPEN. Deirdre is a co-PI for a HRB study, which is investigating mechanisms which support healthcare professionals working in acute care settings to adopt assisted decision-making into their practice with older patients and their family carers. So today, Deirdre is going to talk to us about a recently completed scoping review that she conducted with her colleagues Aidan O'Shea and Marie O'Shea from the School of Nursing, Midwifery and Health Systems, as well as Diarmaid Stokes in the library in UCD. And what this scoping exercise is capturing is some of the emerging evidence for new ways of working in health and social care of older people in response to COVID-19. And they've actually published a paper on this scoping review in the International Journal of Environmental Research and Public Health, and I'll include the link to that paper, which is open access at the end of the talk. So thank you very much again for joining us from colleagues both within and outside of UCD. So this is going to be a fireside chat, so an informal discussion with Deirdre. So we're going to kick off now, but please feel free throughout the discussion to post any questions or comments or observations you may have for Deirdre in the Q&A box. And then at the end of the session, we'll leave time to answer any kind of questions that the audience members may have. So without further ado, I'm going to welcome Deirdre. Thank you very much for joining us today. So I read the paper that you and your colleagues published on the scoping review on new ways of working with older people in COVID. And it's a really fascinating read. I highly recommend it. So can you maybe just introduce the project and I suppose the rationale or background for conducting this scoping review and how it ties into the ongoing Eclectic project that you and your colleagues are working on at the moment?
Okay, well, thanks for the introduction, Sinead, and thank you for reading the paper as well. Yeah, well, actually, the background to the review is kind of interesting because it came out of a little bit of necessity because of what the kind of lockdown or the first wave of the pandemic, the COVID-19 pandemic. So the background involves the scoping review or the review of emerging evidence was conducted as part of an overall study called Eclectic. And the Eclectic is a HRB applied partnership project, which actually started last September 2019. The aim of Eclectic was to develop a framework which would describe key competencies for interprofessional collaboration. This would be interprofessional collaboration within multidisciplinary care teams that are integrating care for older people across community and acute settings. So the aim of the project is to describe, I suppose, what knowledge, skills and behaviours are required from healthcare professionals who are operating or working within those teams. So we were in the middle of, I suppose, the data collection phase of that project when COVID-19 hit and the first lockdown suspended the data collection. And I'm happy to talk about that later, actually, in terms of how we had to pivot the project a little bit to kind of respond and adapt to, and actually see COVID-19 as a bit of an opportunity really for the project. But anyway, so we were at that point where the data collection was suspended and we were obviously, like everybody, realizing that older people were being disproportionately affected by the pandemic. They were at much increased risk of experiencing vulnerability because of the physical distancing and the social distancing that was happening, particularly in that first lockdown. And we also know that they were far more likely to be hospitalized, far more likely to be critically ill, and far more likely to die from the virus. We were also hearing anecdotally from our colleagues and collaborators on the Eclectic project that they were experiencing huge changes in how they were working, particularly at the team level. It was becoming very clear that interprofessional working was essential for the continued delivery of services for older people, particularly those living in the community. And huge flexibility was being required in terms of how the team members were working, particularly as they moved towards more telehealth and using technologies for communication. So as you mentioned, Aideen Nihei, Dr. Aideen Nihei, who is a co-investigator on the Eclectic project. So myself and Aideen decided that we needed to try to see if we could capture some of this emerging evidence that we were hearing, that anecdotally from the ground or from our collaborators. But this was still very much in the early days of the pandemic. So this was last March, April, and there wasn't really much traditional research being published in journals at that time because it was still so early on. So we had to think of a different approach in terms of how we were going to capture that evidence. And this is where Aideen's wonderful creative research brain and her creative expertise came to the fore. And she suggested really that we might use Twitter and social media. And she could see that there was a lot of evidence emerging from Twitter, where health and social care professionals were taking to Twitter to describe what was happening on the ground at that time. So we approached Diarmuid Stokes in UCD Library. Diarmuid is the subject librarian for our school, and he's an incredible resource for us researchers in terms of developing and implementing robust strategies for capturing evidence. And so together, the three of us worked to develop a systematic search strategy to retrieve evidence from print media. So we wanted to look at newspaper archives. So we used the Nexus UK database and also from Twitter as well. And once we had that search strategy developed, we worked with Marie O'Shea, who's the project manager for the Eclectic project. And I think is in the audience today for this discussion. But so Marie came on board, and the three of us worked together then to screen evidence in that kind of systematic way through Twitter and Eclectic. Our focus really was looking for, trying to really gather and bring together some of that emerging anecdotal Twitter newspaper type of evidence around new ways of working in response to the pandemic. But our particular focus really was on new ways of working and team working in the care of older people.
Okay, thank you very much, Deirdre. Fantastic. So in terms of the methodological approach that you briefly discussed there, I suppose if you could maybe explain why a scoping review approach was adopted and what exactly it is. And I know you touched on some of the different phases of the methodology, but also particularly then the validation phase that you conducted with actual care workers.
That's right. So we had three sources of, I suppose, of our evidence. So the first one, it was Twitter, and I suppose Aideen really led on that because that's where she's kind of an expert on that kind of approach. But so she used the Twitter advanced search function to retrieve tweets which mentioned new ways of working. Now that was much more broad, so we wanted to capture new ways of working across all health and social care. So it wasn't really focused on older people, but just more broadly, and really try and capture, just get a very broad overview about what changes were happening at that time and how they were being described by health and social care professionals on Twitter. For a more focused look, to look down and really drill down about what, to focus really on older people's care. That's where we looked at the Nexus UK database, which is a database of newspapers and newspaper articles. So we developed it with Diarmuid, a very systematic approach to searching across newspapers. So there's a little bit of an emphasis towards the UK publications, but it does have all the national broadsheet publications as well. And we were looking there for articles that described innovations in team working for older people. Newspaper articles, and we, and so we developed kind of 4 search strings, which really allowed us to kind of hone in on that older person's care and that kind of collaborative working. But then, so those searches were done between the 1st of March and the 11th of May. So that was our time frame for that kind of systematic search. And then once we had kind of completed that screening and kind of brought together the themes that we were seeing in that from those sources, we conducted a workshop with members of the interprofessional working group of the Irish National Integrated Care Programme for older people, so in the RCPI. So we brought, these were representatives of health and social care professionals who are working with older people in integrated care settings. And we brought them together. It was 11 healthcare professionals together with the research team, and we presented what we were finding out of the Twitter and the newspaper articles, and they sort of substantiated it and confirmed it really, and also really gave some really good insights in terms of what was being experienced on the ground really, and kind of transposing some of those findings to what was happening in Ireland in the Irish health settings.
Okay, very good. And in terms of the findings, I know there were a number of themes that kind of emerged from both the Twitter analysis and also from the Nexus analysis, and be interested to learn more about the key findings that came out of your research, whether there was anything that I suppose surprised you or that was unexpected, and whether it really kind of was consistent with the experiences of the on the ground healthcare workers that you actually then conducted the workshop validation process with.
Yeah, so from the Twitter search, we found 317 tweets that describe new ways of working, and we kind of broadly categorized them into 6 categories. I think so. The most common or most dominant theme from the Twitter, the tweets, we'll say, was that teams felt empowered at a local level. So this was very early stages. Remember, this data was collected between March and May. So we're still at the very early stages of the pandemic, and there was a really strong sense of people feeling really empowered to do things at a local level, to make changes that previously maybe would have taken a lot longer, to do, that they could rapidly implement changes quite quickly. And aligned to that was that they felt that there was some, I suppose I feel like the Twitter data was very much capturing a mood at that time. And there was a sense that everybody was galvanized towards a common enemy, which was the pandemic, and that some of the old hierarchies that had existed in kind of as presenting obstacles to change were removed, and there was rapid changes happening. And a lot of that involved a huge amount of interprofessional working and collaboration. Of course, telehealth is probably one of the biggest features of those changes, the most obvious feature, and there was a lot of reliance on technologies and phone consultations, and a lot of creative use of technologies to continue to providing care to older people, particularly in the community settings. And that's something that's definitely noted for sustaining beyond, and thinking about how we might sustain that beyond. And I know we might return to that at the end of the conversation, but the other area obviously was using this technology for continuing team meetings, for team huddles, but also for rapid guideline assimilation. So clinical guidelines and clinical practice standards were being developed at a rapid pace, because the evidence and what we knew about how to manage that virus was changing so quickly, and was developing so quickly. So that meant as that was trickling down to frontline workers, that was, they had to assimilate and implement those guidelines so quickly. And that was coming across in the Twitter data. There was a lot more discussion of trust within the teams, because they had to rely on each other. They had to communicate more effectively, think of new pathways for communication as well. That was very much the broad overview of what was happening across the health settings. But when we drilled that down to look at what was happening in older people's care, particularly through the newspaper articles, which we got a lot more detailed descriptions of innovations there from these newspaper articles, we could see definitely, I suppose, the newspaper findings were kind of clustered around 4 main themes. So one was around role expansion. So, and that is a huge theme, and something that we're taking forward when we're looking at the next phase of the eclectic study. But that there was a massive expansion of scope and role for healthcare professionals. This involved them compensating for across disciplinary roles, so compensating where a discipline was missing from the team because of redeployment, a lot of transference of skills across disciplines, a lot of sharing of responsibility, sharing of assessment, etc. So massive expanded scope of practice, rapid acquisition of new skills, etc. So that was one area. The other area is the innovation around communication. So the use of online technologies, the use of virtual technologies as well. And particularly what was interesting from the newspaper, there was a lot of accounts of how they were using those kind of innovations and technologies to focus on the social and emotional support for older people in community settings as well. And there was a very strong awareness of that as a necessity. Then there was obviously another domain is around the physical environmental restructuring that happened. This is particularly relevant for the acute settings and for residential settings as well, where they had to physically alter the buildings essentially and create red zones and green zones and COVID wards, etc. So there was a lot of physical restructuring as well, and also a kind of human resource or redistribution of human resources across those settings. So we saw a lot more kind of collaboration between acute settings and nursing home settings, for example, in terms of personnel moving across. And that, I suppose, also reflects in these new kind of team compositions where you had a lot more collaboration across settings. And of course, the other kind of dominant domain for the newspaper was around this enablement, and I suppose the use of technologies for this rapid acquisition of new skills, the kind of new knowledge being assimilated and transferred into practice. So that was sort of what we came out of our review of that Twitter and newspaper evidence, and then we brought that to our working group. And so you asked about how they felt about it and how they felt that reflected what was happening. And I think by and large, a lot of them could see, kind of really recognized, and it resonated quite strongly with what was happening for them on the ground. They did speak a lot around that issue of how barriers were very swiftly removed, particularly in that initial phase. So that things that would have previously, required a lot of bureaucracy or a lot of hierarchical, structural, decision making, that lateral decision making was quite evident at the early stages, and that's when, if things needed to happen, they had to happen, and that was it. Because it was a kind of impetus to react to what was coming down the tracks. Technology was huge, and and remains a huge, I suppose, feature of this pandemic, and the use of technology to facilitate telehealth and also interdisciplinary communication as well, and how knowledge was shared across disciplines in a much more formalized way through the use of technology. They definitely spoke about that common goal being a unifier at the beginning, so that that they were all energized and galvanized to focus on one common enemy, and that helped, and it helped in terms of that sense of collegiality, a sense of focusing together. But I would say even in that early stages, and that was back in June when we held that working group, there were concerns emerging already at that stage, and that was particularly around gaps in service provision, particularly where there was withdrawal of services in the community and where there was redeployment of staff, particularly out to testing sites. And there was also concerns raised in that working group around the psychological impact on the well-being of staff at that stage as well. I suppose, yeah, and that's something we're seeing now as we're in this next phase of the project. Yeah.
Absolutely. Thank you very much. So what's next for, I suppose, the findings from the Scopus review and the Eclectic project, and maybe how these findings might feed into your ongoing work with the Eclectic project, and as you move forward?
Yeah, so as I said, so the Eclectic project started last year in September 2019, and in the first phase of the project was this co-design phase, actually, where we worked with members of that interprofessional working group, the subcommittee of the integrated care program for older people, and we worked with representatives of older people as well, and we were kind of working on co-developing and scoping out kind of core competencies for interprofessional working. So that phase sort of ended in January, and we were in the midst of the second phase of the project, which was a data collection phase. We were focusing on interviewing team members from two teams, one urban, one rural, who are responsible for integrating care for older people across the community and acute settings. And we had conducted 24 interviews up until March with members of these two teams, and obviously that suspended in March. But so we're currently at the point of kind of taking that up again, I suppose, and we're doing the interviews online now, or virtually, or over the phone, remotely, we'll say. And so we're conducting a second wave of interviews at the moment with members of the two same teams. And I see that kind of as an opportunity in a way, because we have a unique perspective, actually, because we're able to kind of prospectively follow these two teams through this pandemic. So we have data collected from them before the pandemic really hit, and now during the pandemic as they're going through it. So we have a kind of unique and interesting perspective in terms of what's happening on the ground in two teams who are working for older people during this pandemic. And I suppose we're really now trying to reflect on and to integrate what we've learned from the scoping review and what we're learning from those qualitative interviews, and really tease out those competencies that we had developed in the first wave, the core competencies for interprofessional working, and to really put some nuance on them. And actually some reflection about what's happened during the pandemic to teams can help us to learn what can be sustained beyond this pandemic. And I think sustainability is the key here. So that rapid review was very much done at the very early stages, and it represents the mood at a very specific time of this pandemic, where there was people galvanized towards that common enemy, where there was some sort of energy, and it was almost a positive energy in a funny way that we were capturing, particularly in the Twitter data. But that's changed now, and we can really see the cracks starting to appear now. And I think we're hearing about staff who are exhausted, they're burnt out, they're frustrated at redeployment, they're frustrated and concerned and worried about the gaps in service provision as well, particularly in the community. So I definitely, that's concerning. And I know that there is also particular concern, particularly in the area of service provision and gaps and the strain on teams that's resulted from that redeployment. And we also know that safeguarding is a very particular concern at the moment. And I know our colleague and co-investigator on the project, Dr. Sarah Donnelly, is really championing this issue. And she has produced some, excellent and very concerning insights into the challenges of safeguarding older people at the moment, particularly where we have social workers redeployed, or where we have social workers who are restricted in their ability to access older people in their homes. But I feel I should finish on a positive note. So while we are seeing those cracks and we're seeing, the burnout and the safeguarding concerns, etc., I do want to finish on a positive note, because I think we are all a bit fed up and burnt out and tired now at this point in the pandemic. But I suppose what we saw from the emerging evidence and what we saw in that initial phase of the pandemic was hugely encouraging from a health systems perspective. We now have evidence that our health system is not some slow moving glacier, or at least it doesn't have to be. We saw evidence of agility in the system. We saw flexibility in terms of the ways of working. And most importantly, I would say a massive amount of creativity and collegiality among health and social care teams broadly, and specifically among those teams that are charged with delivering care to some of the people, in our communities who are arguably the most adversely affected by this pandemic, and who have the potential to experience a high level of vulnerability. And I think it's hugely positive. And I suppose from my perspective, standing somewhat removed and a little bit on the outside from an academic lens, I find it hugely inspiring.
Great, thank you. Just to remind everyone that's watching that we have around 6 minutes left. So if you have any questions or comments, feel free to submit them. We actually have a comment from your colleague Marie O'Shea, who, as you mentioned, worked on the scoping review and is the project manager of Eclectic project. So she says, what has come across very strongly from the Eclectic research has been the willingness of HSPCs to adapt at an individual and a team level. The depletion of community services due to redeployment has been one of the major barriers to integrating care transition from hospital to home. Teams have tried to change their ways of working to compensate for this, which I think is very, what I'd be interested to know is, I suppose, what, as personally as a researcher, how have you adapted to COVID and the current situation that we're in? I mean, you talked about how you've, yourself and your colleagues undertook this scoping review as an opportunity, given the challenges posed by COVID, and you have had to adapt in this current environment to ensure that your research is continuing and that you are availing of these new opportunities that have presented themselves.
Yeah, and I think that I suppose from a researcher perspective is kind of interesting in that we've had to really pivot the project a fair bit and change our, we haven't changed our endpoint, and so we're still working towards the same goal, but we're going to achieve that in a slightly different way. And I think rather than see the pandemic and the lockdown and the kind of suspension of our data collection as a problem, I saw it more as an opportunity. And I think Aideen was hugely inspirational in that perspective as well, because she was very much, could see this happening on the ground and really had that energy to kind of say, let's try and capture this, and I think that, I think rather than, I suppose, try and stick to what we had originally planned, I think we had to think about how we could be innovative and how we could see this as an opportunity. And I think really we actually have a really unique perspective in the fact that we have this sort of almost pre and during, and like I said, that prospective qualitative lens now that we can say, okay, we've almost tracking these two teams through this phase, and what can we learn from that in terms of could we see the COVID-19 and the pandemic and the response to that pandemic as a massive system-wide intervention and an opportunity to create real and meaningful, long-lasting and sustainable change for the health system. So yeah, so that's where we positioned the project. But yeah.
And do you think it is possible? I mean, there's been a lot of, as you say, positive new ways of working as well as some challenges. Do you think it is possible to sustain those beyond COVID? And do you think that healthcare will be forever different now, as the way many of our working environments are going to probably forever change now due to the pandemic in terms of, working from home and remote working? Do you think there will be, or do you hope there will be long lasting impacts in terms of maybe more interdisciplinary working and better ways of communicating, telehealth, and also maybe a slight flattening of the hierarchy in terms of more collective leadership within healthcare?
That's the burning question, isn't it, Sinead? I think that that's something that we're all kind of scratching our heads or soul searching at the moment to think what will change and what will the future look like. And I again see that as a huge positive. I think it's a huge opportunity for all of us, no matter where we're working, really to kind of step back and say, well, what are we going to continue and what will we return to, and how will we change? And I think there's no doubt that everybody is changing. Within the health system, I think that move towards telehealth has been a massive shift. And while it absolutely has its flaws, and we can see that coming out now in terms of concerns around service gaps in service provision, worries about the lack of face-to-face interaction. I think there are parts of that telehealth and that innovation and communication even within the teams and across disciplines that can be sustained and should be sustained. And I think there's a will to sustain that as well. I think particularly looking at older people's services at the moment, there's a huge recognition in the system that there is that older people's care requires a focus and requires investment and requires change and innovation. And I think that now is a really good time to actually capture that energy and actually and innovate, because a lot of what's happening, I think people have known that these changes need to happen. There has been a drive towards integration of care. There's been a recognition that we need to have more person-centered care and that kind of focus on the individual, that journey of the integration of the care journey from acute into to community, etc., and more integration and sharing of knowledge across those services. I think we knew that up until the pandemic. I think we now know it very strongly. And I think that now is the chance really to try and to grab that and to make the changes that need to happen.
Yes, hopefully we can ride that wave of change and improvement, but obviously with the resources and supports that.
Yes, yeah. And I think that's the key. I think now there's a strong hand really to actually claim and to advocate for those resources. Yeah.
Fantastic. Thank you very much. I'm just checking to see if we have any questions. So thank you, Marie, who's involved in the project, who's just submitted a bit further information around the project there. Thank you very much.
I'm very enthusiastic project manager.
So I think we'll wrap it up there, if that's okay. Thank you so much, Deirdre, for taking part in our seminar series and for sharing the findings of the scoping review that yourself and Aideen and Marie and Dermot undertook, and as part of the wider Eclectic project. It sounds really interesting and very timely. So best of luck with the rest of that project. We've just got a thank you there from Ahmed as well. Thank you very much. So I'd also like to obviously thank our audience members for joining us today from both within UCD and out of UCD. So thank you very much for tuning in. Just want to let you know about our next talk. So next week on Wednesday, the 25th of November, again at 2 p.m, Professor Brian Caulfield from the School of Public Health, Physiotherapy and Sports Science, and he's also the director of the SFI Insight Centre for Data Analytics at UCD, will be talking about the rollout in Ireland of the International Detect project, which enables volunteers to contribute their heart rate data from a wearable device such as a Fitbit in a bid to create an early warning system for viral illnesses. So sounds very interesting and very timely, and we hope that you'll be able to join us next week for Brian's talk as well. So please feel free to check out the UCD COVID-19 research response website, and you'll find further registration details there. So we'll wrap up there, and thank you very much everyone again for joining us, and have a nice afternoon.